very pleased to have an opportunity to discuss Dr. Coventry's recognition as a giant or a pillar of orthopedic surgery. I trained at the Mayo Clinic, and without any question, in my early years of training, the most dominant figure in Rochester, Minnesota, and in the United States, and actually nationally, was Mark Coventry. Dr. Coventry is still known to many individuals, not just my generation, but even younger generations. One of his greatest contributions, in my opinion, was he was the first person to ever put in a total hip of the Charnley variety with FDA approval. Interestingly, the FDA approval wasn't for the total hip. It was for the methylmerthacrylate. And that was done in March of 1969, which is exactly 50 years ago. When I learned of the Pillar program, the very first person I thought of was Dr. Coventry. I got out our history book of our department and looked up the fellows or the residents that he influenced over the years. We have over 900 fellows and residents that have come through Mayo, and I would say that he directly influenced over 300. So it was a relatively easy matter to try to contact the alumni organization and therefore our orthopedic alumni and seek their support. I'm pleased to say that the support came in readily and with enthusiasm. One consideration when discussing Dr. Coventry as a pillar of orthopedics through the AOA program is to recognize that Dr. Coventry himself was president of the AOA in 1978. Dr. Coventry's contributions to orthopedic are numerous. He actually designed one of the early prosthetic knees and was very influential in the design and particularly the documentation of outcome of hip joint replacement in the United States. One experience that I particularly remember is we were doing a case. I was a first-year resident, and Dr. Coventry did something during the procedure. It was a total hip. And I asked him, I guess without thinking, Dr. Coventry, do you routinely do that? And he stopped the case. He looked at me across his half-lens glasses, and he said, no, Dr. Morrey, I don't routinely do it. I regularly do it. And so what I learned from him then was you got to think about what you're doing. If you do it routinely, you're not thinking. So there are many things that I could say about Dr. Coventry that in my mind, and I think in the mind of all the residents at Mayo and even the orthopedic surgeons around the world that he touched, was his integrity, his passion for teaching, his passion for documenting his and others' activities, and trying to improve patient care. For these and for many, many other reasons, Dr. Coventry is a giant in my eyes, and he is certainly a pillar of orthopedics.